Good afternoon, everyone. My name is Robert Boyd, and I'm the CEO of the School-Based Health Alliance. It's my high honor to introduce one of our board members, Ceci Oregon. Ceci is the executive director of Kaiser Permanente's Institute for Health Policy. In her role, she leads strategy and operations for the Institute. Her specific areas of expertise include access to healthcare for underserved populations, as well as behavioral health, school-based health, and early childhood issues. Ceci joined KP in 2013 as the Director of Safety Net Programs for the National Community Benefit Program. In her role, she helped accelerate safety net grant strategy and initiatives. She also fostered the development and spread of national and regional safety net partnerships. Prior to KP, Ceci served in program officer roles for the Blue Shield Foundation of California and the California Endowment, where she managed portfolios of grants focused on strengthening California's healthcare safety net and improving access to healthcare. She also served as an analyst for social legislation for the Congressional Research Service in Washington, D.C., and as a special projects associate for the Alameda County Public Health Department. Ceci has a bachelor's degree in social welfare, a master's in public policy, and a master's in public health, all from the University of California at Berkeley. She currently serves as vice chair of the Alameda County First Five Commission and sits on the boards of directors for Insure the Uninsured Project and the Northern California Grantmakers. Ceci is a true champion for access to healthcare for all. Friends and colleagues, Ceci Oregon.
Thank you, Robert. And now it's my pleasure to introduce Annie Reed. Annie Reed is a friend and colleague at Kaiser Permanente. She's the executive director of the Thriving Schools program, where she leads strategic development, oversight, and evaluation of large-scale initiatives aimed at addressing social drivers of health in schools and communities. Annie has worked at the intersection of public health and public education for 15 years and has worked in several school districts, including Fontana Unified outside of Los Angeles and Chicago Public Schools, where she worked to embed health policies and practices into schools district-wide. She's originally from Chicago and received her BA from Middlebury College, her master's degree in public policy at the University of Chicago, and her doctorate in public health from my alma mater, UC Berkeley. Here's Annie.
Thank you so much, Ceci and Robert, and good afternoon, everyone. Good morning, depending on where you are. What an honor and a pleasure to be here with you today at this conference. I am a longtime admirer of school-based health centers and am grateful for just the incredible work you all do to help support the ecosystem of health in schools. I remember when I first worked at the Chicago Public Schools, I was at a school in a neighborhood called Lakeview, and I walked into what they told me was a school-based health center for the very first time, and my mind was blown. And then my husband ended up working there, who's an educator, and so I got to visit Lakeview High School's a school-based health center many times, and have been just a long-time admirer of the work that all of you do. So I'm just so happy to be here and appreciate the opportunity to talk a little bit about what we do at Kaiser Permanente, and hopefully how we can really lock arms and work together over the course of the future, really, to ensure that every school is a healthy school through what we're calling a 10-year roadmap for healthy schools. So what I thought I would do today is really give you a little bit of a sense of who we are at Kaiser Permanente, what we do in Thriving Schools, and then really spend most of the time talking about the National Healthy Schools Collaborative, of which the School-Based Health Alliance is an important member, and the work we've done to create a 10-year roadmap for healthy schools together, including really how you individually and as an organization and as a collective can get engaged. So let's get started. As I hope most of you know, Kaiser Permanente is the nation's largest integrated healthcare system. We serve over 12 million members across 8 different regions, and many of you probably live in those regions, and shout out to those of you who are KP members. We're really a mission-driven organization. We exist to provide high-quality, affordable healthcare services and to improve the health of our members and the communities that we serve. And that's not just a mission, that's actually something that we live and breathe every single day, including what we do in schools, which I'll talk about in just a second. But we know that health doesn't happen just within the four walls of our medical office buildings. It happens everywhere with everyone in the communities where we live, work, play, and learn. And that's why at Kaiser Permanente, we created Thriving Schools about 10 years ago. So we know that our health and education outcomes are inextricably linked. Health impacts education, and education impacts lifelong health. We also know that health interventions in school settings really can have incredibly significant impacts on healthy behaviors, which I know I'm preaching to the choir here, but schools matter, of course, for the health of our communities. And we also, at KP, 1 in 5 of our members is actually in a school setting every day between teachers and staff and students. So health in schools is extremely relevant to our mission as an organization, as a place to really influence and improve population health. So this work really isn't about placing more burden on educators and school communities to solve a public health challenge. It's really about how we can put health at the center of education to improve outcomes for both health and, of course, for learning. So Thriving Schools, as I mentioned, is really KP's sort of manifestation of the commitment to schools and districts across the country. And we work to ensure that teachers, staff, and students have the support they need to thrive in learning and in health. We really aim towards what we call our North Star, which is that every school across the nation has equitable access to supports for the many dimensions of health, including physical, mental, and social, because we want every school to succeed, every employee to excel, and every child to thrive. So all the work that we do is really in service of that mission. So how does that actually manifest? Well, we at KP, through our Thriving Schools initiative, we focus on more than just the students. Of course, the students are incredibly important and the centerpiece of much of what we do. But we take an equally important focus on the teachers and staff in the building, sort of that old adage of having the oxygen mask on first, so that the students can really benefit from teachers and staff and who are centered, who are resilient, who can take care of their own health and well-being. And then, of course, the teachers and staff themselves have more ability to succeed and excel and derive satisfaction from the work that they do, because they're in environments that support their health. Our focus is really multidimensional. We know, obviously, that health happens in systems, it happens in settings, it happens in bodies, and you can't extract physical health from mental health, from social health. We really think about this as a comprehensive approach that incorporates dimensions of physical health, mental health, social health, also racial equity and access, because we obviously know that health and well-being is interconnected. And we do a lot of different work to support those different dimensions. We work through grant making, through advocacy, convening and coalition building, and also offering a compendium of tools and resources to schools and districts across the country. Just to sort of drive the point home about how we take this integrated approach, you see here that we really do a lot to look at the interconnectedness of these different health dimensions. When we started Thriving Schools about 10 years ago, it was really focused on physical health, but we've adapted and expanded to think more about the interconnectedness and how we can integrate these different dimensions of health rather than siloing them. So just to give you a couple of examples, for physical health, we have nutrition resources, an anti-vaping curriculum through Know the Truth. For mental health, which of course is an extremely important, salient issue right now, even more so than it has been, we have created an initiative called RISE, or Resilience in School Environments, which supports social and emotional well-being for all elements of school life, including, again, for teachers and staff, as well as for students. In terms of social health, we have strategies to address food security, college and career readiness, transportation, housing, et cetera. And then for equity and access, we're actually in the process now of developing a more concrete racial justice strategy, though I will say that all the work that we do is really built on a foundation of equity. And we continue to look at how access to care, which of course is so relevant for this group, can be supported in school settings. So that's a lot. I will take a breath and also just give you a sense here of all of the different resources that are free of charge to schools and districts and to folks like you who are working in and with schools to avail yourselves of. We have a lot of different types of resources that we really think of this as sort of a no wrong door approach, where depending on where you are in the journey of school health, you can come find the resources to support the different topical areas that you're looking to address. That could be, our website. It could be through our educational theater team, which is a group of incredible health educators that provide different performances and programming to experience for teachers and staff, as well as for students, more about different dimensions of health. And you can see the other types of resources available on this slide here. So that's what we do and how we do it. We have really had the opportunity to reach thousands of schools and districts. And these are just some of the key sort of elements or data points that we've had for 2021. We've had a playbook that reached over 11,000 folks, and that was in collaboration with School-Based Health Alliance and others. We have different COVID response materials and resources that have gone out. We have an integrated assessment that really the Thriving Schools portfolio is built around. It's sort of the backbone of the work we do. And I'd encourage all of you, if you haven't, to check out our website, Thriving Schools, to look at the assessment and be able to really identify where in the journey of school health you're interested in digging into it. It helps identify opportunities and challenges, of course. And I will really say we do not do this work alone. This is really in collaboration with a cadre of external partners, but also it's leveraging the extensive health expertise of Kaiser Permanente, which we have a lot of internal expertise that we can use to ensure that we are really wrapping schools around with an ecosystem of trusted organizations and partners so that they can be a beacon of health in their communities. And that leads me to really talk about the National Healthy Schools Collaborative, which is one of the things that gets me out of bed in the morning. And then I just couldn't be more excited to talk about and invite all of you to participate in. So, Robert knows well that when the first week in 2020 and March of 2020, when schools were beginning to shut their doors for what we thought was going to be 2 weeks or 3 weeks at the onset of the pandemic, we brought it together, a group of school partners that we'd been working with, some for a long time and others newer really to working with us at Kaiser Permanente, just to say, what is happening? I think, sort of scratching our head, what are you hearing? What do schools need? And most importantly, I think, how can we as a collective of organizations that work to support school health use one voice to communicate about what is truly a crisis at the intersection of public health and public education, to ensure that schools have the resources and the information that they need. And that began, I would say, sort of as a bit of a ragtag or a group that came together on a regular basis to share, to brainstorm, and to begin to collaborate to meet the needs of schools as we were learning about them. So we first started by doing sort of a rapid response. We had a series of webinars that we did. We then transitioned to develop a playbook that I hope many of you used. I know School-Based Health Alliance was awesome about disseminating that playbook across the many partners that are, I'm sure, represented here today. And then we realized the power of a table for us to come around. This group really hadn't had a place to put our heads together to start to think about what is the future that we want to see in schools. How can we, for better or for worse, leverage this crisis to really say that health has to be at the center of education. This isn't an option. It is a need, and it is part of an equitable approach to education, is ensuring that every child, every teacher, every staff person in a school setting is able to thrive in a healthy school environment. And so we formalized into what we call the National Healthy Schools Collaborative. And you'll see a list of some of the members here on this slide. We've grown pretty significantly over the course of the last, I guess, 2+ years since we first convened. And we are so excited that once we sort of put together a vision for what we wanted to do, we realized that we wanted to have a collective understanding and vision for how we could come together over the course of the next 10 years to ensure that the policies, strategies, resources, metrics that we use to measure school success, funding mechanisms, et cetera, all came together to really support healthy school environments. So that led to what we're calling the 10-year roadmap for healthy schools. And I will just say that really the 10-year roadmap is a fluid roadmap. It is not a document that we want anybody to print out and put on their desk and forget about after they've read, the first 2 pages of. It's a living, breathing, changing call to action, really for stakeholders from across education and health sectors, as well as decision makers at all levels of government, to really dramatically increase the alignment across systems over the next decade to ensure that every school is a healthy school in our nation. And we really believe that by advancing bold and ambitious initiatives together, that we can create this much needed transformational change. Before I go on, I do just want to say that one of the beautiful and challenging parts of this process is that we brought together a diverse set of stakeholders, and that's what you need to make this kind of ambitious and much needed change. That said, we also took a pretty consensus-driven approach. And so while I go through the elements of the 10-year roadmap, I just want to note that these decisions were collaborative, they were consensus-driven, and not every decision was unanimous, unless it's specifically indicated on the website or in the document, which you can download on the website. But really, the views and opinions that are published in here, including don't necessarily reflect the views of every organization, and they do not reflect the views of Kaiser Permanente. But we all felt like this was such an important call to action, such an important body of work that all of these organizations, I think 20+ organizations, signed on, and we continue to really encourage others to get involved. And this is just the beginning of what we see as a movement to support healthy schools and shifting the culture so that every school is a healthy school over the next 10 years. So moving to the next slide, I'll just say that the members of the National Healthy Schools Collaborative really work together to create the content. I think I hope I made that clear. It was really deeply influenced by stakeholders who are closest to school settings and closest to students. So just for an example, we did a lot of Healthier Generation, with much gratitude to them, conducted a national survey that reached hundreds of educators. We have been identifying opportunities to engage students in this work. So we're really looking at a comprehensive, inclusive approach to how we do this work. We've also garnered the endorsing support of many organizations who aren't officially parts of the National Healthy Schools Collaborative, but this is a growing list of organizations, and we invite all of you to join in and help support the roadmap, which I will dig into right now. So really, our mission is to develop a bold, ambitious, and action-oriented set of opportunities that dramatically increases the number of healthy schools over the next decade. And that will be through coordinating and accelerating the interconnectedness of health and learning. And again, we want every school to succeed, every educator to excel, and every child to thrive. So we are not joking. This is a big vision, a big mission. We get that. We get that it's ambitious. That is by design. And that's why we need all of you to get on board and help us so that this becomes a reality. In developing the roadmap, we also came up with some sort of collective guardrails for how we wanted, or principles, if you will, for how we approach the work. First, the roadmap had to emphasize wellness, equity, and access, and comprehensive support, not just for students, but also for all adults within the building. We wanted the roadmap to be informed by stakeholder voices, and some of them I mentioned already, like students and educators, but also for families, unions, and their representatives, members of the broader health ecosystem, including healthcare. We want the roadmap to be grounded in evidence. We want it to acknowledge that educators really need the training, tools, and resources to support and prioritize their health, and that they need resources in order to do that. We want to encourage flexibility and adaptation and innovation in this space. We know that we can't get where we want to go by doing the same stuff we've been doing. And so we really want to take an ambitious, bold, and innovative approach to this work. And then finally, we want to inform the way that stakeholders think and speak about healthy schools. We don't want healthy schools to be something that just people like us think about every day, right? We want this to be something that our communities are demanding, are calling for, are understanding, that we're not a niche, healthy schools or school health sector, but that this is something that everybody sees and recognizes as vital to the health of our communities, to the health of our nation. So, drum roll. This would be much more fun if we were all in person. I will share the 10 priorities for the next 10 years. So the first priority is to create shared goals that really recognize the importance and interdependence of all elements of a healthy school. And that's really because we are so used to working in silos, and that promotes competition for limited resources and really limits how we can advance a shared vision. So we really want to see things like more of a center of gravity for this type of work at every level, federal, state, and the local level, that would coordinate across the different pieces of healthy schools so that we are working in tandem rather than working against each other. The second priority is to institute adequate and equitable funding. I know everybody I feel like if we were together, I would hear hopefully some rounds of applause for that. We need these models to be, again, at every level. And that's the idea, is that all of these things have to happen at every level, federal, state, and local, to create and sustain healthy schools. Because we know that the traditional and centralized staffing-based funding models really are not leading to the equitable allocation of resources that's needed to scale and sustain the type of change that we're seeking. So an example is, how can we ensure that there's adequate funding for employees at the school and district level, like nurses, psychologists, counselors, physical educators. I'm going to leave somebody out, but for anybody who touches health, that there is adequate funding and sustainable funding to support that type of work at the local level. The third priority here is to bolster our health system quality, healthcare services, social services, capacity. We want it really to provide primary care, because we know that continuity of service is associated with preventing health barriers to learning. Obviously, the easier it is for our kids to get access to services, to the health services they need, and more quickly they're able to be seen, then the easier it will be for them to re-enter the classroom ready to learn. And here we really think that providing guidance for states and districts on how they can prioritize the continuity of care in partnership with health organizations is extremely useful and something that we can lock arms to do collaboratively. And then the fourth priority on this slide is about providing healthy spaces to learn. And I think everybody, especially with this group, can totally understand the importance of having school buildings that foster healthy activities, healthy learning, and literal health access, as many of you do, is just so critical. And there's so many opportunities that are unexploited that we can pursue in that arena. All right, so that's 1 through 4. Let me take you up to 5 here. The fifth priority is to really optimize existing funding streams, because of course we know that research really bodes that money matters for student achievement. And so how can schools and districts and states even better use the many dollars that are available to them? That's been increasing over the last few years, but sort of these consistent funding mechanisms like Title I, Title II, Title IV, ESSA, IDEA, et cetera, to ensure that there is a comprehensive, scalable, and sustainable approach to funding healthy schools. The sixth priority is to make sure that we are all, again, just locked arms around the importance of healthy schools, so that this isn't some anomalous sort of, one and done initiative, but that there is really, truly public awareness and understanding of why healthy schools matter. The seventh priority is to improve. This one gets a little wonky here, but I think a lot of you will appreciate this, is that we need data. We need data to understand what's going on with our kids, to be able to share data between health systems and schools, so that we can better support kids in the aggregate, or individually, but also schools in the aggregate, as well as teachers and staff. So just to really, again, support that continuity of care, which we know this is a big one, because there's a lot of privacy data or privacy laws that rightfully protect the data that for students and staff. We don't want to see those things eroded, but we want to make sure that there are ways that we can safely and more efficiently share information, so that we can better serve our schools. We need to address workforce shortages. I'm sure all of you see and feel this, especially now, every day. We need to attract and develop and champion educators and school health staff who reflect the populations of the communities that they're serving, where they work, live, and play. Because we know that those professionals, educators and health professionals, are critical to the success of students in school buildings, and that these are just much needed jobs that can support the health and vitality of our communities as well. The ninth one, if we can go to the next slide, is really supporting, in particular, families, but really the public at large, and becoming partners in strengthening the health and learning outcomes. Beyond sort of that critical awareness that I think begins this journey about the importance of healthy schools, we really need families, caretakers, and communities at large to be partners in this work, right? So one example would be to really figure out how we can release guidance and best practices for how we can meaningfully engage families of different backgrounds to be involved in school activities that address healthy school goals and priorities. And then finally, number 10 is all about enhancing the ability of community-based organizations. How can they identify and mobilize people and communities around issues related to healthy schools? Because those partnerships are so critical. Really, if we're going to create this ecosystem of health in our communities with schools as one of the most critical hubs, we need to do that in partnerships, and schools cannot do it alone. So these partnerships are just so critical, but not every school has equitable access to those partners. Not every school knows how to partner. Not every organization knows how to partner. So how can we really strengthen the backbone, including funding, and other sort of communications and best practices that we can leverage and foster to be sure that those relationships and those partnerships are in place. So that is the backbone. Those are the priorities of the roadmap. There's a lot underneath that. I encourage you to check out the website, read the priorities, figure out where you fit. How do you see yourself? What are you interested in? Hopefully a lot of these things resonate for you, but we really feel like this is a once in a generation opportunity, frankly, to really be able to influence how schools can be more central in ensuring that they're part of public health, and that public health includes schools, so that we do not find ourselves ever again in a situation where schools are closed in some places across the country for a year plus. So the roadmap is really not one size fits all. It's a framework to consider what it will take to create healthy schools in your community. Not every community is going to do all of the things that are listed in the roadmap. Not all the priorities are going to resonate for everybody. But again, this is a fluid document. It is aspirational. We see this as outlining some of the many paths that you could take in your community, in your state, at a national level, to get to this vision of every school, every community being healthy through a commitment to healthy schools. So on the website, you'll be able to find sections that are based on your interest in federal, state, or schools or districts, and you can go right to the Take Action page to see how to get started. So just to shore this up here, and just to express my gratitude for your time here today and the opportunity to talk more about what we're doing. We see you as critical partners in this work, critical players in this work. So please, visit our Thriving Schools website if that seems like a good place to start. Of course, we also have the Healthy Schools Roadmap that you can check out at the website that's listed here. Follow us on Twitter. And of course, you'll be able to find a lot more information about the roadmap through the School-Based Health Alliance. We are so extremely grateful for Robert and the organization's participation in this work, and for the opportunity to speak to you. And thank you in advance for all of the work that you do to support the health and well-being of our students, staff, and teachers. And with that, I will say goodbye and have a great conference. Thank you all so much.
Amen.